My motivation for going into anesthesiology is fairly complex, but I think it boils down to a couple of things. Most people who go into anesthesiology, like myself, really like the practical application of pharmacology, physiology, anatomy. They like doing procedures, yet they also want the intellectual challenge of managing very complex patients in real time. So in anesthesiology, it's a lot of internal medicine or pediatrics, yet in a very fast-paced environment. Well, there are two things. I think one is more internal, and the idea that you can do a job and know you did it well and have a very successful outcome and know that internally. And the thing is, in anesthesiology, people expect perfection. Every patient expects to wake up at the end of a general anesthetic. They expect to wake up comfortable. They expect to wake up without any nausea or other problems. So you have a very high expectation to manage that. So meeting expectations is the minimum that you can do, and so you need to get some internal rewards. But I also like taking care of very ill patients, and that can be extremely rewarding. When you take care of patients that are literally on death's door, and at the end of the procedure, because of your care, they are actually in better shape than when you started. Frequently the patients and their families appreciate that, but it's very rewarding to know you took somebody literally from the brink of death and helped resuscitate them. Well, that's a good question. What makes the ideal applicant, and what do we look for when we're selecting applicants for a residency program or counseling people who want to specialize in anesthesiology? I think there are two aspects. The first one is the medical knowledge, and the second one is the people skills. So you need someone who has a broad-based medical knowledge, has to be fairly deep, and you have to be able to apply that in real time. In anesthesiology, we rarely have the luxury of going and look something up, or you see on that TV show House where there's this team of doctors going to the library and looking up obscure symptoms. Well, the patient's not breathing. I don't have time for that. I got to figure out what am I going to do next. So that knowledge base, the technical skill, the ability to apply that in real time is one big aspect. But the other side of it is the people skills. We're working in a very complex healthcare team, other physicians, which maybe are surgeons or other procedural physicians. We work with physicians in critical care, pain medicine, on the floor in consultations, nurses, advanced practice nurses, physician assistants, in our own specialty, nurse anesthetists, anesthesiologist assistants. You're working with OR nurses, techs, managing a complex environment. Very commonly, anesthesiologists manage ORs. And so you need to have the people skills to put all that together. And when you're dealing with a patient, be able to win that patient's confidence in just a few minutes in your preoperative interview. Well, I think the time that you can devote to your personal life, family versus your work life is very much up to the individual. There are people who will devote 100% of their time to work. Not too many people, unfortunately I might say in this day and age, devote 100% of their time to their family. So finding that work-life balance is very important. In anesthesiology, there are a number of options for that. People or students think of us as being one of the lifestyle specialties. I'm not really sure why. I presume that that's because whoever made that term up was not an anesthesiologist. But one of the differences between anesthesiology and some of our colleagues, and perhaps internal medicine to a greater or lesser extent, or surgery, we almost always know when we're on call or not, when we're on duty or not. And I think that gives the impression of having more control over your time. And to some extent you do. you can find a position that has more call, less call. If you work in an ambulatory surgery center, you may never work a night or weekend. On the other hand, if you're in a busy trauma center and an academic program, you may find yourself taking calls several times a week. That may be in-house, it may be at home. But there are the options. You can do office-based surgery. I have a colleague in Florida who has switched entirely to office-based surgery, and he doesn't take jobs, he doesn't take assignments when he wants the day off if he wants to go on vacation. Doesn't get paid either, but he can control his hours. So I think regardless of what specialty you go into, that work-life balance really is a personal decision. And I think it's going to be changing in the future as we see more and more employed physicians in either healthcare systems or large group practices. Well, my personal biggest challenge is having to get up so early in the morning. I am not a morning person. But other than that, I think the biggest challenge in the field is dealing with the interpersonal interactions. The medical knowledge, technical skills, those are something most people can acquire, they can get good at. But the people skills are something that are more difficult to deal with. So dealing with the political environment, and unless you are a solo practitioner covering one or two offices, like my friend covers about 20 or 25 offices, you're going to be interacting with all sorts of people with their own perspectives, with their own agendas, their own needs, and being able to juggle all those different personalities and situations and needs is a very big challenge. I think the thing I would emphasize for everyone going into anesthesiology is not to underestimate the interpersonal communication aspect. And I've said in a couple of my responses today how important that is. When you look at what you really do, the technical component is one small part of what we do. But leading teams, interacting with other physicians, other healthcare providers, other clinicians, interacting with the patients, their families, all that requires good people skills. And that sort of caricature of anesthesiologists from decades ago as someone who doesn't want to talk to people going into the field because, oh, the patients are all asleep. Well, like I said, I have 5 minutes to take a history, develop an anesthetic plan, and win the patient's confidence immediately before the most stressful time in their life as they're awaiting surgery. That takes a lot of interpersonal communication. So if you can't get along with people, this is not the field for you.